Welcome to GW Hospital Healthcast. I'm Oscar Ceballos, and I'm happy to have Dr. Farzad Najam, who is the Chief of Cardiac Surgery at George Washington University Hospital. He's here to talk about the specialty of mitral valve repair that is conducted by Dr. Najam and his team at GW Hospital. Dr. Najam, thank you for joining me today.
Thank you so much, Oscar, for having me.
Before we got started with this interview, I mentioned in passing that as a child I had a heart murmur or a leaky valve, and you said, wait, we're going to get to that. So as an expert in cardiac surgery and procedures, one of your many specialties is mitral valve repair. Can you tell us more about that procedure and the mitral valve?
Well, thank you so much, Oscar. And I think that's a very pertinent finding and subject that you broached. So mitral valve, as you mentioned, it's a valve which is between the left upper chamber and then left lower chamber, or in more technical terms of left atrium and the left ventricle. The left ventricle being the pumping chamber of the heart, which pushes blood to the rest of the body, to the brain, to the gut, to the kidneys, to the liver. Now, mitral valve is a valve which again a passive valve which opens because of the pressure differential between the different chambers of the heart. So it allows blood which comes back to the heart through the pulmonary veins, and then it opens once the pressure in the left atrium goes up, and then allows blood to go into the left ventricle. And when the left ventricle is ready to pump blood to the rest of the body, the mitral valve closes so the blood does not leak backwards, so that there's only one way for the blood to flow. So it forms a very important valve so that blood can continue to flow in one direction. And there are multiple pathologies of mitral valve which we can discuss, but a leaky valve, which you mentioned, means that the mitral valve is not closing, and the blood, when the ventricle has so much pressure built up so that it can push the blood into the aorta to the rest of the body, the mitral valve doesn't close, and the blood, some of the blood leaks back into the atrium.
Thank you for that context, Dr. Najam. What makes a good candidate for mitral valve repair?
Excellent question. And again, it depends on what the condition is. As I said, the mitral valve can be leaky or mitral valve can be a blocked valve. Majority of the patients in the United States who have a leaky valve, they fall in a category which is in the medical terms called myxomatous valve disease, which means that the mitral valve is not a normal structure. The mitral valve is a very flimsy valve. It has two leaflets or two parts which come together and close. The mitral valve, as I explained to my patients, is it works like a parachute. The only difference between a parachute and the mitral valve is in parachute, you have one canopy without a joint. In mitral valve, there are two components which come together and form a part of the canopy. So they come together. Both these components are subtended by very tiny strings called chordae. And those strings are attached to two outpouchings or out projections of the heart muscle called the papillary muscles. So when the ventricle builds up the pressure, those muscles pull down on the strings and close the canopy. So there are two components of the canopy and they come together and close. And this is an area, if you look at my fingers, how my two hands come together, they come together very tightly and the valve closes. Now, as you can imagine, these strings which are attached to the heart muscle are made up of very elastic and flimsy tissue. Some patients who have degenerative or myxomatous heart valve disease, these flimsy strings get very thickened, and over a period of time, those strings lose elasticity. And when they lose elasticity, they start getting elongated and they start stretching. It's like an elastic band. It starts stretching and it loses its elasticity. And once it loses its elasticity, the valve, instead of closing like this, it closes like this. And when the cords break, you can imagine that the canopy of the parachute is not going to hold air. In this case, it won't hold in any blood. So when the valve's supposed to close, One part closes, but the other part doesn't close. So blood leaks back from that gap where those two parts of the mitral valve are supposed to close. That part is the most common pathology of mitral valve leakiness in the United States. The other reason for the mitral valve to become leaky is that the mitral valve, as all the valves are joined on a ring, and that ring has the mitral valve leaflets which are attached. So those leaflets, if the ring gets bigger, those leaflets are not going to be able to come together. So if the normal ring is this way, the valves close, but if the ring is too big, the valves don't close.
Mm.
So they can close, they will, the strings are fine, but the valve is too far apart and it doesn't come together, or in other terms, it doesn't coapt. And that leads to the valve leaking. Why does that happen? It's called functional mitral regurgitation. If the left ventricle gets bigger, then the ring gets bigger. If patients who develop atrial fibrillation, which is irregular heartbeat, the left atrium starts getting bigger, and then the ring of the mitral valve starts getting bigger. And that leads to the valve not coming together. The third reason, which we see also, is infection of the heart valve. In patients who get infection of the heart valve, one part of the valve will get eaten up by the bacteria or the virus or the fungus which is infecting the heart valve, and then that part of the valve gets destroyed, and that leads to leakiness of the valve.
Thank you. Can you share the importance of mitral valve repair and what sets GW Hospital apart in using it?
Well, I think one of the things which sets us apart is that mitral valve repair is actually even a subspecialty of heart surgery. Not all cardiac surgeons do mitral valve repairs. The reason mitral valve repair versus replacement with a prosthetic valve is important because it is more natural, and patients get to retain their own tissues, and we don't have to put a prosthetic valve, which avoids them from taking blood thinners. Also, it's if you don't put a prosthetic valve, there are less chances of that valve getting infected. So, and also um, by some accounts and studies, if we repair the patient's own valve, it has a favorable impact on the left ventricle because the mitral valve forms a complex which makes the left ventricle work at a much better geometry. So repairing the mitral valve is way more important than replacing it. And repairing the mitral valve is not only science, it's an art form as well, because sometimes I have to cut some pieces of the mitral valve and join the other pieces together. So it really relies on a good understanding of the mitral valve physiology and the anatomy and what the pathology is and how would we repair that pathology so that mitral valve can become competent and it closes when it needs to close. As I explained earlier, majority of the reason for leaky mitral valve in the United States is myxomatous heart valve disease. 2 to 3% of people born in the United States carry the diagnosis of mitral valve prolapse. So that means that they are born with a murmur, and they, before college or during normal physical exam, somebody would hear a murmur. Only about 18 to 20% of those people who have mitral valve prolapse would require mitral valve surgery in their lifetime. The other problem is once the mitral valve starts becoming very leaky, then it requires surgical intervention, because without an intervention on the mitral valve, if it's severely leaky and patients start developing symptoms, then the left ventricle starts getting bigger and bigger and bigger. And those patients don't have a normal 5-year survival as compared to patients who have the mitral valve repair done. At the George Washington University Hospital, my specialty is to repair those leaky mitral valves where those mitral valves don't have to be replaced. We can repair it with multiple techniques that I'm comfortable with in repairing those mitral valves.
What does recovery look like for someone who receives mitral valve repair?
Usually, because this repair is done through open heart surgery, those patients who receive open heart surgery, generally they're in the hospital for 4 to 5 days. And after that, they go home. And the only restriction for about 8 weeks is that they cannot lift more than 5 pounds or they cannot drive for 4 weeks. This is for younger patients who require open heart surgery who are good surgical candidates. I also do a procedure called MitraClip, which is a minimally invasive procedure, which is for patients who are not surgical candidates. MitraClip is reserved for patients who are prohibitive risk, who are older, they have multiple comorbidities, and they cannot be candidates for mitral valve open repair. So those patients are repaired through the groin, where we go through the groin and cross over to the left atrium and put a clip called the mitral clip, which brings the mitral valve together in the middle and makes the mitral valve, instead of being one big opening, into a double barrel opening. So that procedure is only reserved for patients who are not surgical candidates.
Okay, if a patient has been identified as a candidate for this procedure, they may be apprehensive to go in for elective surgery. What are the risks if someone puts this off?
That's an excellent question, Oscar, because the dangers of putting it off is that, and I see this a number of times, um, the left ventricle starts getting bigger and bigger. Once your heart starts getting bigger because of mitral regurgitation, the surgery gets more complicated. The other risk with mitral regurgitation is that the back pressure on the heart is transmitted to your lungs, and the lung pressures, which is called the pulmonary artery pressure, starts going up. Also, because the pressure is transmitted to the upper chamber of the heart, which is the left atrium starts getting enlarged. And a number of these patients would present with irregular heartbeat, which is called atrial fibrillation. All of those problems simply illustrate that there's a problem with the mechanics of the heart. The heart is supposed to function at an efficiency where there's flow of blood one way. Anytime the flow starts going in a reverse direction, the heart's going to compensate, but there's a cost attached to it. And the cost with mitral regurgitation is that the volume that the heart, the left ventricle, has to have to sustain a person's life is at a much higher level than a person who doesn't have a leaky mitral valve. Just to give you a very simple equation, a normal stroke volume, anytime the heart squeezes, the volume of blood which is pushed into the uh, uh, the body is about 70 cc's. Now, by definition, severe mitral regurgitation is 60 cc's of blood every time the heart beats. So if the heart's supposed to pump 70 cc's of blood forward, but 60 cc's of blood goes backwards, there's only a net gain of 10 cc's of blood which goes forward, which is not compatible with life. How does the heart compensate? The heart starts compensating over a period of time by becoming a bigger bag, and it stores a larger volume of blood. So that means for a heart which needs to pump 70 cc's of blood forward to keep an individual alive, and 60 cc's is going backwards, it's keeping 130 cc's of blood in itself. So it's getting bigger and bigger and bigger. And that's why at a later stage, when patients present who have mitral regurgitation, their heart's bigger and they have developed atrial fibrillation, they have pulmonary hypertension. Those problems make the postoperative recovery much more complicated than if patients present with symptoms or they have severe mitral regurgitation and they have other indications to proceed with surgery.
Dr. Farzad Najam, Chief of Cardiac Surgery at George Washington University Hospital, thank you for making the time to join us today.
Thank you.
For more information about mitral valve repair, please go to gwhospital.com.